Good afternoon. For those of you that do not know who I am, my name is Dr. Baldwin. I am a clinical geriatric pharmacist at Resources for Seniors. All that means is I spent a lot of time in school and a lot of time outside of school learning all about geriatrics, learning all about how as we age, our bodies change, our medication usage should change, and there's all kinds of things that happen as we get older, like our kidneys age, which alter how medications are used. Other big things that we learned about are how something like how diabetes changes versus if you got diagnosed at Jacob's age, is he a baby? Or if you got diagnosed, he's going to regret being in here now. Or if you get diagnosed at your age, there's a huge difference in how long you have had a disease state and how well you age. So all of that put together, I spent a lot of time learning all about that. I was asked by the two, I would say lovely ladies, but only one of them is a lovely lady. No. In the back to give a talk about falls and medication specifically. As a pharmacist, I know a lot of people don't understand why a pharmacist should be involved in falls and falls awareness. Also, I obviously pace a lot. If I'm hard to follow because I pace, I get very drastic, I use my hands a lot, you can wave, yell at me, holler at me, you can throw something at me. If it hits me, props to you, I'll try to avoid it coming. But a lot of people always ask me why is a pharmacist involved in fall awareness, and it's because medications are a huge reason. As a pharmacist, we are trained in pharmacy school that if somebody falls, if there's a problem going on, it is first and foremost find their meds, look at their medications, look at how you are taking your prescription medications, and then it gets to be the fun part of, oh, what kind of supplements are you taking? What kind of herbals are you taking? What kind of vitamins are you taking? When do you take them? Nowadays, I also ask, well, do you drink? How much do you drink? I don't care if you drink. I just want to know how much you drink, how much alcohol you drink in a day. Do you smoke? Now I have to ask, what do you smoke if you admit to smoking? Because there are drug interactions. There are drug interactions with whether it is nicotine or whether it is CBD. Or now I really have to ask, because it is technically legal in parts of North Carolina, do you smoke marijuana? And I always tell people, because those questions always make people uncomfortable, I don't actually care. I would say when I have had a client sit across from me and they will admit to using marijuana products, I'm like, I don't need to know, technically illegal, not-ish. Here in the state of North Carolina, I don't care, but here's now the drug interactions. Because there are drug interactions, whether it is a supplement, whether it is an herbal, whether it is a multivitamin, there are often drug interactions with prescription medications. And a good clinician shouldn't tell you you shouldn't do those without a very good reason. But we want to know because there are very severe drug interactions or drug disease interactions, whether it is an herbal product, whether it is something you're eating, we need to know because there are all kinds of interactions and we worry, we in the healthcare, we worry about falls. Because the bottom line is 1 in 3 of you will fall. And sadly, that's a normal fall each year. The problem is how the overall arching number of falls is underreported every single year. People don't want to admit they fall. I have a family member who's fallen twice. Yesterday. That's yesterday. Both times hit their face and refused to let EMS be called. Both times. Which means both those falls, unless the family member that was there with them reports it, they'll go unreported. So the number one, when you hear people talk about statistics of seniors and falling, those numbers are often underreported. 1 out of 5 falls results in an actual serious injury, often head or worse, hip fracture. And the reason I say or worse hip fracture because that's the fall we worry about with causing death. So if Marlene back there stumbles, falls, breaks her hip, statistics tell me there's a 50-50 chance Marlene won't see it this time next year. That's why healthcare providers worry about falls. That's why anybody involved in an aging agency, in an aging program, worries about your risk of a fall. It's not because I need to know. Good healthcare providers, and you have coming someone who will look at your shoes, I often do when I go different places and I talk to people about their medications and their supplements. It's not uncommon for me to look at their shoes. They don't have terrible shoes back there. I often find women, we are terribly guilty of this. I'm that guilty of it today. Wearing shoes where our toes or our heels hang off. You have someone that will talk about that. We worry about vision issues because if you can't see the cracks in the sidewalk, guess what's going to happen? You're going to fall. So we worry about all of these things. And the big thing is hip fractures account for a huge component of death. Ladies, the sad thing is we are more likely to fall than our men are. Part of that has to do with, I can't count how many of you have a purse. And it's a purse, not a backpack, because that shifts your weight. A lot of women, we wear fun shoes, but they shift our weight around. Institutionalized, so the moment you go into a home, you are more likely to fall. And the big thing is, well, why? The older we get, the higher the likelihood I know that there's a chance of a fall. If you are 80 or older, it's a 50% chance that you'll fall in a given year. It is 30 to 45% if you're 65 and older that you'll fall in a year. Why? Main thing is you're aging. Your body's not as young as it used to be, which means you have a loss of muscle mass. You have a lower body weakness, you have arthritis, which may impair your ability to grab stuff, catch stuff. Arthritis in your spine can stop you from, impair your ability to fall correctly. Not enough vitamin D. There are issues with walking. You have vision issues. You have cataracts. You might not see the curled up throw rug in your house because you don't have sufficient light and that throw rug's going to trip you up. You could have a health condition like a stroke. And one thing about strokes is you might not catch it, but your toes can curl under when you step, and you won't notice because you have nerve damage, which can increase your risk of a fall. Vision issues can increase your risk of a fall. Pain and arthritis can increase your risk of a fall. Because when you hurt, are you really paying attention to how high you're picking your foot up going upstairs? You're thinking how much you hurt. The biggest thing as a pharmacist, what I worry about is what are you taking, how are you taking it, and are you taking it correctly? The words that pharmacists would use would be, if they're talking to their peers, they'd say, I'm looking for all of the medications that have anticholinergic effect, or are on a list of medications called Beer's drugs. Those are medications that we know as healthcare that increase your risk of fall. So the big thing is, well, what are they? We look for those. And also we look for something called polypharmacy. That is a part of healthcare sometimes that it's not uncommon for seniors or individuals with very complicated healthcare to have. It's where you have a multitude of healthcare providers. And you don't always tell them what you're taking. So you end up having upset stomach, nausea, diarrhea, and you go to physician one and they prescribe something. But what they didn't look at your medication list and see that you are taking a garlic supplement, and what they prescribed for you interacts, and now you have a bleeding risk and you fall. So there's lots of things where you treat a side effect with another prescription because we don't catch it. So polypharmacy contributes to older adults' risk of falls. So what are the medications or supplements or over-the-counter products that increase your risk of a fall? Biggest ones that we think about are pain medications. And in this category, it does not matter if it is a drug like ibuprofen, if it is a drug like Tylenol, or if it's an opioid like Percocet, oxycodone. All of those together increase your risk of a fall. How? One, the narcotics make you tired, they make you sedated, which means you feel groggy when you get up. You might not recognize that something is in your way and you can trip and fall. Drugs like ibuprofen and Aleve or Tylenol can also increase your risk of a fall indirectly because people don't want to take them, they can't take them, they hurt their kidneys, so they're trying to stay. They know, like Marlene back there, let's say that she knows her knees hurt her constantly because she's constantly moving up and down, so she takes ibuprofen even though a physician has said, don't do that. It's not good for your long-term kidney health, and Marlene's like, absolutely not gonna do that. So what she does is she takes it anyways and she says, well, I know that it's gonna hurt my kidneys, so I'm gonna keep hydrated and stay hydrated and drink a lot of fluid. And then Marlene's teaching her class and she's like, oh, I have to go to the bathroom. And so we run and we don't think about that, and that increases our risk of a fall. Sleep aids, Ambien, Lunesta, Sonata, and Entresto. Those medications, a physician and a pharmacist should tell you, please take it right before bed. I tell people when they take them, please be in bed, not right before you go to bed, because if your life is anything like half the people I know, you can take it in the bathroom as you brush your teeth to go to bed, but oh, your phone rings and you go to get that. And the problem with those drugs specifically is they kick in and it's a very small window. So you could be answering the phone, walking back to your bedroom when that medication kicks in. And then you get tired, sedated, and your risk of a fall. I also need the over-the-counter products like Benadryl. Because the side effects of Benadryl are dry mouth, dry eyes, which means your eyes feel gummy that next morning. Dry eyes, see, you can't pee. Dry mouth, dry eyes. You get constipated, and they make you feel groggy. Benadryl or chlorotrimazole or diphenhydramine make you feel hungover, which means you can't see correctly. You stumble over stuff. Most households have cords, electrical cords. A lot of people, a lot of houses that I go into have throw rugs, which means if you're getting up because you took one and you're like, I'm tired, I just need to run to the bathroom, you don't see those. And when we stumble, we bounce into walls and we bounce off. I have minions at home and they will bounce off of everything, and it's a short trip for one of them just right across the hallway. But those are real. Those are things that make us increase our risk of falls. As a pharmacist, when I sit down with someone, when I have sat down with Marlene, for example, I look at how she takes her medicine. Does it say take it with food? Does it say take it without food? Does it say take it once a day or twice a day? What is the medication that you're looking at? Because it isn't just the big things that we think about. Pain medicines. It's not just the anxiety medications that people may take. It isn't just antidepressants that people take that make them tired, that make them sedated, that make them groggy, or give them blurred vision, that increase your risk of a fall. It's also managing common disease states like diabetes. Because if your sugar goes up, one of the very common side effects of very high sugar is blurred vision. And your blurred vision means you can't see well. Complications of that long-standing blurred vision is you develop or can develop diabetic retinopathy, which means tiny black spots in your vision that don't move and don't ever go away. And that can increase your risk of a fall. High sugar can increase your risk of a fall because you can't see and you're stumbling, you're confused. The opposite is also true if you have diabetes. Your blood sugar drops too low. Same thing, side effects of too low blood sugar is blurred vision. You get confused. Sometimes people don't know where they are, depending upon where their sugar is in the aspect of blood sugar. So those are things that people don't often think about, that as we treat diabetes, I'm gonna pick on Christine. Let's say she comes in and she's a baby.
I'm not a baby.
I'm gonna pick on
Babies apparently she thinks I'm ancient. So.
You are ancient. Jenny Griggs, who's the director of the senior center, is absolutely a senior. So let's say she comes to me because her blood sugar's been out of whack and she's trying to get it, and she's like, what do I do? How do I treat it naturally? People can, but diabetes increases her risk of a fall because she gets up at night. She can't manage her blood sugar. She's going to the bathroom all the time. So Jenny starts trying to manage her blood sugar by timing how she eats, and so her blood sugar drops. She gets more active. She starts to lose weight, and she doesn't tell her physician what she's doing. And it's been 2-3 months, and Jenny's very aggressive at being active and very aggressive at trying to eat right, eat the small amount of carbs that she needs. And so her blood sugar drops too low, so she's gone from too high to too low. So she runs and increases the risk of a fall. Other things that are very common disease states that increase a senior's risk of a fall: blood pressure. When your blood pressure goes too high, it damages those blood vessels in your brain, which can increase your risk of a stroke. Then you have walking issues, can increase your risk of a heart attack, and heart attacks can they can be very hard to recover from. Constant high blood pressure over a long period of time increases a person's risk for heart failure, which means the things that they like to do, they can't do. People get angry and depressed and they don't care. So high blood pressure can increase your risk of a fall. As we treat it, let's say I treat Marlene for blood pressure control because it's always sky high, but she gives up salt and she doesn't tell me as her clinician she's given up salt or eating salty foods or cat foods that are high in caffeine, drinks that are high in caffeine. Not myself. I did say caffeine.
I swear you said cat food.
Caffeine.
Oh.
Give the nectar of the gods. Comes in that brown liquid that I drink a lot because it feeds me.
Yeah, it's your blood.
It is. But low blood pressure makes you groggy, makes you tired, makes you stumble over things that aren't there, makes you feel weak. Those make you that when you feel weak, you are at a risk of a fall because you might not be able to pick your foot up as well or notice that something is a fall, a trip hazard. Small objects. If you have grandchildren or great-grands, small dogs, cats, cat toys, dog toys, Legos. Bane of my existence, soon to be the bane of Jacob's existence. Because they're sharp, they're pointy, and people jerk. And when they jerk, as we get older, our ability, I can jerk my foot and manage to keep myself relatively steady. That system is old. It ages just like you, outside of all of your disease states, your nerve damage, all of that, so it is, you have a risk of a fall. High blood pressure, diabetes, high cholesterol. It isn't so much the high cholesterol, I mean it can be, that can increase your risk of a fall, but those medications we often use, statins, their number one side effect are muscle aches and pains. And it is the big muscles often. The big muscle groups, the ones that help me pick my feet up or pick something up that hurt and that ache. And so people stop taking them because they're like, I can't function. I know people who struggle to open up pill bottles because they're like, everything, I can't grab it, open it because it hurts now that I've been on rosuvastatin. And those are real, legit things that impact your risk of a fall. Because the bottom line is if your cholesterol gets too high, you have poor blood flow in parts of your brain, parts of your body, including your brain, which then increases your risk of a stroke. You get poor blood flow in parts of your heart, it increases your risk of a heart attack. So it becomes a back and forth of how do you manage this? There are people who take antipsychotics, not because they have an antipsychotic disease. Those medications can be used for pain, nerve pain. Those medications can be used to supplement or make an antidepressant work better. They are notoriously well known for causing dizziness or grogginess, which then increases your risk of a fall. There are lots of over-the-counter interactions with prescription medications. There are interactions with garlic. Turmeric blew up big when COVID happened because it had immune system boosting effects, but it also can irritate your stomach and cause a bleed. If you have a bleed in your stomach, you will feel weak and tired and off. So it's like there are a ton of drug interactions. I am not, Marlene will tell you, and well, Marlene may not because she got perturbed at me. But anybody that hopefully has sat up here with me when I do one-on-ones will tell you I am not anti-supplements. I'm not anti-herbal. I'm not anti-anything. I'm giving my job, and a good clinical pharmacist job should be if someone says, I need to have a drug review, it has been at least a year. Should be less than that, honestly. The data out there says senior, it actually says adults, but it's specific, since I specifically work for seniors, it says seniors should have their medications, their supplements, their herbals, know that reviewed at least twice a year by a pharmacist who will go through it all and make sure that you are taking it appropriately. Because sometimes once a day doesn't mean I don't need you to take this in the morning. Works best if you take it at night, and here's why. Because sometimes it's just, it may make you tired during the day. I have sat with someone and I made a very simple suggestion of, I need you, or I would like you to switch this blood pressure medication from the daytime when you're taking it to the evening. We talked about why, they told their physician why, and they're like, I did. And about a month later, like, I feel so much better. They had energy because of how potent this particular blood pressure medicine was. So they were better able to manage themselves and manage their disease state. But everything that you put in your body, prescriptions, supplements, herbals, should be looked at and reviewed by a pharmacist at least once a year. Because a good clinical pharmacist can walk you through, oh, Jacob, I see that you are on a new inhaler. Show me how you use it. Because if you can't use your inhalers properly, you can't get good oxygen, can't breathe well, that can increase your risk of a fall. Oh, Marlene, I see that you are on some new GLP drugs. Walk me through how you give it to yourself. Because there's technique with the injectables, there's techniques with insulin. How do you use your eye drops? Do you know that there's a technique for eye drops? Do you know that there is a well, somebody said no, there is. Eye ointments. There's a better time of day to use an eye ointment versus not. Those are always recommended in the evening because they leave your vision blurred, which makes it hard to see. And that blurriness doesn't go away quickly. It can last for 5 minutes, which means I do not need you to run around your house. I need you to sit at the end of the day to use your eye ointments. But those are things people don't often think about of what a clinical pharmacist can do and why you really should have your medication looked at least once a year. Because it's worth it. It can make a huge difference in how you feel and decrease your risk of a fall. I sit with people routinely, and sometimes it is just helping them better time their prescription medications with their supplements. So there's no drug interactions, no drug food interactions, no drug alcohol interactions. So they manage to the best of their ability to decrease their risk of a fall. Because I genuinely don't want anybody to fall, which is why some of you have seen me fall for Marlene in one of the big rooms back that way, and probably again later, I don't remember when, although we just talked about it, because it's such a big deal. Because if you fall, it is really a 50-50 chance that you will not be here in a year. And those are statistics. I'm being aggressive. Some of the statistics say as low as 30% to upwards of 65% of if the senior falls due to complications of a hip fracture specifically, they will die within a year. So that's why falls are so preventable. If you use insulin, it is a huge risk because if you still use an insulin needle, it's hard to see the little ticks on there. Have a pharmacist walk you through. If you use an insulin pen, sometimes it's really hard to see that number. Do you know that there are tips to how to see the better number on your insulin pen? Most pharmacists won't tell you, but if you listen closely in a quiet room, you can hear them click. And that can decrease your risk of a fall because you're not just visually relying on what you think. You see 6 versus 9 versus 8, which that difference between 6 units of insulin to 9 units of insulin, that can be enough to keep somebody alive. That's 3 units, and that can drop somebody's sugar potentially 100 points or more, or less. So it's like there are tips and tools out there to help somebody better manage and better take all of their prescriptions and supplements. So use those tips and tools at your benefit. That's kind of all I got. Get your prescriptions looked at.
Dr. Baldwin, I have a question.
Yes.
Okay, you talked about getting your prescriptions reviewed at least twice a year. Can you go to like a Walgreens pharmacy and have it done, or does it have to be with a clinical pharmacist?
Sure.
Walgreens doesn't have time for you.
Thank you.
I mean, no, I'm just asking a question.
There are pharmacists around the county who will do it. I know several of you see me here all the time. I'm here at least twice a month and will be here often extra times because I always tell people, I'm not here to see necessarily anybody. If I have to, I can, but I'm here to steal the Wi-Fi. Because where the office, that sounds terrible, but where my office is versus where I'm at for the rest of the day, I'm often up in Wake Forest or in the Rosedale area, and so it's easy to come over here and have Wi-Fi, so I'm often up here. Like I've actually had, from an earlier talk this morning, I had 2 people want to set time with me, and one's coming to see me on a day I'm already here, which is the 24th, and one, just due to the time for her, I'm weirdly here another day for Marlene, I want to say, and so I scheduled to see her that same day. So I make accommodations, and I personally go all over Wayne County. Like you might see my name over in Wendell, or Garner, or Fuquay, nope, yes, or Morrisville, or Cary. I mean, I go all over Wake County because I work for Resources for Seniors, and we serve all of Wake County, which means I go all over Wake County. So I meet people all the time, and how you meet with me here, front desk has a binder, thank you for that word, because it just left my head, with all of my available dates, with a note that if these dates do not meet, or you are full and you can't meet with me then, they're entitled to give my number, and you can set up an appointment to try to reach me for a sooner or a different date. But I try to be out here at least twice a month to see people. And there are times, like today, I'm here, and I'll see people anyways, even though that's not on my agenda.
How do they prepare for a visit with you? How is the best?
How they should prepare for any clinical pharmacist visit, whether it be me or whomever. Bring it in. I always tell people, if you know in about a week in advance, most people sometimes know less, know more, but if Marlene were going to sit back there and say she needed to come see me, I'd say, cool, come see me such and such date. Between then and now, write down. Do not tell me you're going to remember, because you won't. Because I don't remember when I make appointments for Minion 1 and Minion 2 what I want to ask their pediatrician. I don't remember, so I know you won't remember. So write down all your questions that you have in advance, right? I mean, we all have these things, a lot of us have these magic devices that have a notepad feature somewhere on it, or a calendar where you could put the notes on the calendar on my appointment date. Make notes, write down all your questions. Either bring in all of your prescriptions, supplements, herbals, bring in a list, bring in pictures. I've had somebody who brought in a list of their prescriptions, and they literally snapped a photo of chunks of all of their supplements because they knew I wanted to see the bottle for who the manufacturer was for some of their supplements. So, but bring in everything. If you don't want to bring in everything, I had someone tell me one issue is I have a suitcase. And I'm like, I can come pick it up for you. I can roll it in. I'm good with that. It's easy to see them because sometimes if I want to show you something on your supplement, I can say, this is what I'm looking for, or this is what I don't like on this particular one. But bring in, some people they don't want it, they bring in just a list, also works just fine.
On the regular RXs though, you just need the name, the amount, how it's taken.
Yep. And you'll,
list.
absolutely, and you will catch me, if you ask me, if you bring in a list, I'll say, all right, sir, this says you are taking metformin 1,000 milligrams twice a day. I'm totally making it up, I don't know, just throwing a drug out there.
1,500 once a day.
And that's exactly what I'll ask. I'll say, how are you actually taking this drug? Because I need to know, because there's huge differences with that. That was funny because I pulled that out of nowhere, by the way. But those are things that a pharmacist would ask. How are you taking it? When are you taking it? If it's supplements, sometimes I say, why are you taking it? And I don't mean why in a degrading way. It's like I would want to know. Because sometimes there's reasons why you're taking it that help me understand how to better fit it in your protocol, or how to better fit it in. Sometimes you will hear me say, yeah, no. That does not work with this heart medication because of X, Y, and Z. But I have a lot of people that I will sit down and say, okay, perfect, let's work with this. Or and sometimes I ask, what are your goals of meeting with me? Because that sometimes gives me an idea of, I just want to know if I'm taking everything correct. Sometimes it's very complicated. I would like to know if there's a possibility I can ever come off of any of these medications, and how I go about talking to my physician about coming off of some of these prescriptions, how to prescribe or de-escalate my prescriptions. Also very fair.
Does the drug manufacturer make a difference?
For supplements or herbals, yes, it can. For prescription and over-the-counter products like ibuprofen, calcium products, no. But for supplements, yes. Because not all manufacturers of supplements adhere to the same protocol, adhere to the same standards, that's the word I want, as everybody else, which means they can have a huger variability. So there are things that I look at either on the bottle or on their websites.
Does the FDA have some control over that?
Say that one more time, there was just enough noise and I have the, ooh, look, squirrel.
Does the FDA have any control over that?
That is an excellent question. In terms of does the FDA have control over stuff? The FDA oversees prescription, absolutely, it has to be approved by the FDA before it can go on the prescription shelf. If it is an over-the-counter product, yep. If it is a supplement or herbal, no, that is overseen by the FTC and the FDA does not get involved unless there have been complaints. That's why sometimes over-the-counter supplements and herbals get on the market and then you see was pulled from the market. Years ago, there was a supplement out there, and I can't even remember what it was, but several of them had a large amount of what's called Yochimbe, which can increase blood pressure. The products were, the products were on the market for a variety of reasons, and they had undisclosed amounts of this particular herbal product that was causing problems, and so the FDA steps in then to remove it. But no, supplements, they do not oversee supplements.
So it's safe to take generic drugs?
For most of us, yes. I will be very honest, there are some people, the difference between a brand name product and a generic product is often the inactive ingredients that make up that product. So I have had several people who've sat with me and said they are allergic to, I had somebody tell me they were allergic to magnesium stearate. And I'm like, cool, that's a neat one. And had to research and they could not take the generic of one of their nerve pain meds because it had magnesium stearate in it. So yes, sometimes even though it's technically an inactive ingredient, it might be a problem for you. So yes, they are. The active ingredient, the actual product that does the work, is identical to the prescription. But the inactives can change a lot of it. The inactives can change how it acts for you specifically. The inactives should not change the chemical makeup of it or the technical chemical parameters of how its kinetics, how it absorbs, where it goes once it absorbs, how fast it gets absorbed, how fast it hits your mass bloodstream, how much of it is pulled out once it goes through your liver. All of these other markers are almost identical from brand to generic.
So
For most products. Coumadin, for example, that's a no. If you're on Coumadin, you are staying on Coumadin until the physician and you and the pharmacist say, okay. So there are some very small, there are some drugs that no.
So does that mean that the physicians tell you whether your generic drug is suitable for you, or do you have to look it up yourself?
Most physicians will assume the generic product is suitable for you, and when they write on the prescription, at the bottom of the prescription, there's substitution permitted, which means the pharmacy can fill for generic, or dispense as written, which means they have to fill exactly how it is written. So most physicians assume, unless they get told for a variety of reasons, they'll automatically fill it for generic because they'll write substitution permitted, or they'll sign their name on the line that says substitution permitted. And insurance companies, they're smart, they know that, and they'll charge you way more or not cover a brand name if there's a generic out there. But most of them, a physician will assume the generic products are fine. There are some health conditions like celiac disorder where it becomes a battle because some medications contain a gluten byproduct that they cannot take that's in the generic and the brand doesn't have it. However, the reverse also happens. I've seen the reverse happen where I had a friend that could not take the brand name of a prescription because it had a gluten byproduct, but she could take a very specific, from a very specific generic company, that same product.
So on that point, my wife takes insulin. Is the brand important?
That depends upon which insulin it is. If it is Humulin, for the most part, no. There are some biological similars to it. If it is Lantus, there is a biological similar. So those insulins are unique. They are not allowed by law to have a generic available because they are considered a biologic agent. What they have instead is something called a biosimilar, which means it's made very similar, but it's might be slightly different. But most insulins, insulin N is going to be N pretty consistent. R's are going to be consistent. It's when you get to the more unique insulins like Lantus, Humalog, Novolog, Levemir, 2JO. Those are more likely to have the difference between Lantus, for example, and the biosimilar called Basaglar, which is they're both U100. There might be a slight bit of difference in range. With Humalog, which is a short-acting or bolus insulin that people take for meals, between Novolog and Fiasp, which is the biosimilar to Novolog. Nope, it's Admelog. Admelog is the biosimilar to Humalog. There are slight differences in how fast it kicks in. But for the most part, they're very similar. But a biologic is a smidge different.
May I ask another question?
That's up to the ladies in the room because I know I'm stepping into their time.
Yeah, we're gonna let you have that conversation maybe in an appointment.
Sure.
And you can
Front
talk.
desk.
Yeah.
But front desk, and if they need me, they can get you. Also, Marlene is fast enough. She knows if you need me and they are being obstinate. I'm not saying the front desk is obstinate because they're very lovely, but they can't help you fast enough. She can also get in touch with me as well.
Thank you very
Thank you.
much.